Hello. Welcome to this AI-human hybrid episode of the Lattice Podcast, episode number 105. In this episode, we will summarize the latest news in the healthcare 3D printing space over the last 30 days. You can find a full list of the news, links, and my thoughts in the show notes accompanying this episode. All articles in this episode will also be shared through 3D Heal's social media platforms. I thought it would be fun to try out some new AI tools without losing the human touch with our audience. Imagine being able to print a human liver as easily as we print documents today. Well, that future just got a lot closer with 3 major research institutions receiving nearly $40 million in funding to make bioprinted organs a reality.
That's fascinating, and the timing couldn't be better with the organ donation shortage reaching critical levels. How are these institutions approaching this challenge differently?
Well, let me break down what each team is doing. UT Southwestern received $4 million to combine 3D bioprinting with organoid technology. Think of it like building a living structure where the scaffolding and the actual tissue grow together. They're really focused on creating liver tissue that can maintain long-term functionality.
And I understand Carnegie Mellon's approach is even more ambitious?
Oh yeah, they're leading this massive $28.5 million collaboration with Yale, Duke, and Stanford. The interesting thing is they're tackling 3 major hurdles: getting blood vessels to grow properly in the printed tissue, preventing immune rejection, and figuring out how to scale up production. It's like solving a complex puzzle where all pieces need to fit perfectly.
You know what's really striking about all this? The role of ARPA-H in coordinating these efforts. They're basically revolutionizing how we fund medical innovation.
Exactly. ARPA-H is like the venture capitalist of government agencies. They've got this huge $1.5 billion budget for 2023, and they're specifically looking for these moonshot projects that could transform healthcare. It's the same model that gave us the internet, but now applied to medicine.
Speaking of transformative developments, what about that partnership between Aspect Biosystems and Novo Nordisk? Their work on diabetes treatment seems promising.
That's actually a really interesting story because Novo Nordisk just pulled back from other cell therapy projects, but they're going all in on this bioprinting approach. They clearly see something game-changing in the technology, the potential to actually cure diabetes rather than just manage it.
The economic implications must be enormous. Have you looked at the potential impact on healthcare costs?
Well, here's the thing. While the initial costs will be high, the long-term savings could be massive. Instead of managing chronic conditions for decades, we might be able to cure them outright. Just think about the billions spent annually on diabetes management alone.
And it's not just about the big breakthrough technologies. There are practical applications happening right now, aren't there?
Absolutely right. Companies like Curify Labs are developing printers for personalized medication production, and AZORG is working on integrating 3D printing directly into hospital workflows. These are solutions that could be helping patients within the next few years, not decades.
So what should we be watching for in the coming months?
The key milestone to watch is vascularization. That's really the holy grail for making printed organs viable. If any of these research teams can crack that challenge, we could see rapid advancement. Also, keep an eye on the point-of-care applications. Those are actually reaching patients now.
It really feels like we're at a turning point in medical history.
You know what's really exciting? This isn't just about individual breakthroughs. It's about how all these pieces are coming together. The research institutions are solving the fundamental biological challenges, companies are developing practical applications, and government agencies like ARPA-H is providing the coordination and funding to make it all happen. We're watching the future of medicine take shape right before our eyes.
And with this level of investment and coordination, that future might be closer than we think.
Exactly. And that's why these developments from the past month are so significant. They show we're moving from the theoretical to the practical, from the what if to the when. The healthcare revolution isn't coming. It's already here, and it's being printed one layer at a time.
That's it for this news update. Remember, this podcast is for educational and informational purposes only. The views expressed do not constitute engineering, medical, or financial advice. The technologies and procedures discussed may not be commercially available or suitable for every case. Always consult with a qualified professional. See you next time.